Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Muscle strains and tendon strains. Introduction. A strain is an injury to a muscle or a tendon. A tendon is a tissue that connects muscle to bone. When strained, a muscle or tendon is stretched or torn. A strain is caused by twisting or pulling a muscle or tendon. Strains can happen suddenly, or they can develop over days or weeks. Treatment can help strains heal. This program explains muscle strains and tendon strains. It talks about symptoms, causes, and diagnosis of muscle and tendon strains. It also covers their treatment and prevention. Muscles and tendons. Muscles are found throughout the body. They come in many different sizes and shapes. This allows them to do many types of jobs. Muscles can help you move around and lift or push objects. Some of the biggest and most powerful muscles in the body are in the back, near the spine. These muscles help keep a person upright and standing tall. Other muscles have different functions. For example, the heart is a muscle that pumps blood throughout the body. Muscles are all made of an elastic tissue. Small fibers make up each muscle. Tendons are the tough cords of tissue that attach muscles to bones. They help your muscles move your bones by pushing or pulling the bones in different ways. Tendons can be small, like those found in the hand or ankle. Tendons can also be large, like the Achilles tendon. The Achilles tendon connects the calf muscles to the heel bone. When a muscle or tendon is stretched or torn, it is called a strain. Back and hamstring muscle strains are common. The hamstring muscle is a major muscle in the back of the thigh. Symptoms. Signs and symptoms of a strain can vary depending on the severity of the injury. A strain commonly causes the affected area to be painful, swollen, weak. A strain can also cause cramping, muscle spasms, trouble moving the muscle or tendon. Mild strains may be treated at home, but you should see a healthcare provider if you can't move the affected joint, can't walk without a large amount of pain, have numbness in the affected area. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. A strain is caused by twisting or pulling a muscle or tendon. Strains can happen suddenly. In some cases, they can develop over days or weeks. A sudden or acute strain is caused by a recent injury, such as slipping on ice, lifting heavy objects the wrong way, overstressing the muscles. This can happen with frequent running, jumping, or throwing. Chronic or long-term strains are usually caused by moving the muscles and tendons the same way over and over. This can happen with certain jobs or by participating in sports, such as football, golf, gymnastics, rowing, soccer, tennis. Some people are at a greater risk of getting a strain. These people are overweight, are in poor physical condition, do not properly warm up before being physically active, have a history of strains. Diagnosis. Your healthcare provider will ask you about your symptoms and medical history. A physical exam will also be performed. During the physical exam, your healthcare provider will check for swelling. He or she will also check for tenderness or pain in the affected area. This can help determine the severity of the injury. Your healthcare provider may also move the affected joint or limb in a variety of ways. This can help determine which muscle or tendon has been injured. X-rays may be done to rule out a bone injury, such as a broken bone. An MRI is another imaging test that can help determine the severity of the injury. Treatment. Treatment for strains usually involves resting the injured area, icing it, wearing a bandage or device that compresses the area, using medicines. To reduce swelling and pain in the first day or two, healthcare providers usually recommend resting the injured area. If the ankle or knee is hurt, you may need to use crutches or a cane to get around. Put the injured ankle, knee, elbow, or wrist up on a pillow when sitting. Ice should be placed on the injured area for 20 minutes at a time. You may be told to do this 4 to 8 times each day. Wearing a bandage or a device that compresses the injured area can also help reduce swelling and pain. Your healthcare provider may recommend taking medicines such as aspirin or ibuprofen. These medicines can help with pain and swelling as well. Later treatment for strains might include exercise and physical therapy. Exercise helps to prevent stiffness and to increase strength. Some people need physical therapy. Physical therapy helps strengthen the injured area to make it more stable. You may need to go to physical therapy for several weeks. Surgery may be needed if you have a torn ligament or ruptured muscle. Your healthcare provider will tell you when you can start to do normal activities, including sports. If you begin too soon, you can injure the area again. Prevention. While you cannot prevent all muscle strains or tendon strains, there are some steps you can take to avoid these injuries. To help prevent strains, you should avoid exercising or playing sports when tired or in pain. Tired or painful muscles are more likely to be injured. Eat a well-balanced diet every day. This can help keep your muscles strong and healthy. Try to maintain a healthy weight. Extra weight puts more pressure on joints and muscles, which can increase the chances of an injury like a strain. Exercising every day can help you maintain a healthy weight. Avoid tripping or falling. If you can, stay inside when the weather makes for slippery conditions. Otherwise, make sure to put sand or salt on icy spots on your front steps or sidewalks. Wear shoes that fit well. Get new shoes when needed, such as if the heel wears down on one side. Warm up and stretch before playing a sport. This loosens the muscles and makes them less likely to be injured. Always wear protective equipment when playing sports or riding a bicycle. The equipment helps keep you safe in case of injury. Run on flat surfaces. This decreases the amount of pressure on joints when running. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. A strain is an injury to a muscle or a tendon. A tendon is a tissue that connects muscle to bone. When strained, a muscle or tendon is stretched or torn. A strain commonly causes the affected area to be painful, swollen, weak. A strain is caused by twisting or pulling a muscle or tendon. A sudden or acute strain is caused by a recent injury, such as slipping on ice, lifting heavy objects the wrong way, overstressing the muscles. This can happen with frequent running, jumping, or throwing. Chronic or long-term strains are usually caused by moving the muscles and tendons the same way over and over. This can happen with certain jobs or by participating in sports. Treatment usually involves resting the injured area, icing it, wearing a bandage or device that compresses the area, using medicines, exercise, physical therapy. Surgery may be needed if you have a torn ligament or ruptured muscle. While you cannot prevent all muscle or tendon strains, there are some steps you can take to avoid these injuries. Talk to your healthcare provider to learn more about strains and their prevention. Thank you for using Explain.